Okay, today we are here so that I may share with each of you the dangers of dehydration and to hopefully persuade each of you to take preventive action against it and to take better care of yourselves. Now we know that one of you had suffered from leg cramps, another one had to be hospitalized, and the other one had to receive oxygen and intravenous infusions to counteract the symptoms caused by a lack of hydration. Now as one trained in both first aid and CPR, along with the research I've done, I've compiled information from the Mayo Clinic, MedicineNet, and Medline. I'm qualified to offer you basic information to equip you in preventing dehydration symptoms from occurring in the future. Now, going about your favorite outdoor activities is enjoyable and healthy. Not taking necessary precautions to prevent dehydration while engaging in them is dangerous, but is easily preventable, as I will explain here today. Now, here are some of the following points that I would like to touch on. The definition of dehydration, the symptoms and causes, the risk and complications, treatment and prevention. Now, dehydration occurs when a person's body loses more fluid than it takes in, and the body does not have enough water and other fluids to carry out its normal everyday functions. Now, as seen here in this slide, 75% of the body's weight is due to water. Now, one might ask, well, what are the symptoms? Sticky, dry mouth, sleepiness or tiredness, thirst, decreased urine output, few or no tears, muscle weakness, headache, dizziness or lightheadedness. Now, the more severe symptoms are extreme thirst, irritability, confusion, very dry mouth and skin, lack of sweating, little or no urination, sunken eyes, shriveled or dry skin, low blood pressure, rapid heartbeat, fever, and even delirium. Now, because water is essential to human life, it forms the basis for all bodily fluids, including blood and the digestive juices. Water aids in the transportation and in the absorption of nutrients and helps in the elimination of bodily waste. An average adult loses more than 10 cups of water a day simply by sweating, by breathing, and eliminating waste. In this process, one also loses electrolytes such as minerals as sodium, potassium, and calcium, which are essential in maintaining the balance of fluid in your body. Now, as Alex Shand explained, the hydration levels are regulated by a part of the brain called the hypothalamus. This is when the blood becomes too concentrated as a result of not enough water, and it stimulates the sensation of thirst. Now, as seen here in this slide, this balance can be upset by breathing, as humidified air leaves the body, as we sweat to cool the body, urinating, bowel movement, or even vomiting, and fever. Now, as adults age, the body's ability to conserve water is reduced. The thirst sense becomes less acute, and one is left to respond to these changes in temperature. The dehydration process is cumulative over a period of days. Living at higher altitudes, such as we do, can cause one's body to increase urination and breathing. Inadequate fluid intake can lead to heat injury, ranging from mild heat cramps to heat exhaustion. Seizures, hypovolemic shock, which occurs when low blood volume occurs, causes a drop in your blood pressure and corresponding reduction in the amount of oxygen that's reaching your bodily tissues. This extreme complication can cause death in a matter of minutes, kidney failure, coma, and death. Now, the only effective treatment is to replace lost fluids and electrolytes. One must consume plenty of fluids through the eating of vegetables, fruits, foods of this nature with high water. Letting thirst always be your guide. If you're in physical exertion of any kind, you must drink more often to replace these fluids that are lost during sweating. If you're sick, for example, you must drink plenty of fluids. And in hot and humid weather, you must drink additional water to help lower the body's temperature and replace that that's lost through sweating. Now, in conclusion, at all times, remember to respond to the signal of thirst by drinking water or other fluids. When working outdoors in the garden, for example, or doing strenuous physical activities, indoors or out. Remember to drink plenty of fluids, even if thirst is not present, to prevent the symptoms of dehydration. When you're ill, most importantly, remember to drink plenty of fluids to counteract the effects of dehydration that are caused by your medications. When the weather is hot indoors and the heat is warm, this air causes the dryness in the skin. Drink plenty of fluids to compensate for the lack of moisture in the air. Now let's go over a few things that we've learned today. Dehydration can cause mild to severe symptoms which can easily be recognized and treated. Dehydration can occur for several reasons, not just because of diminished fluid intake. Dehydration is risky and can cause mild to severe complications. Dehydration is easily preventable and treated. And to prevent dehydration and its consequences, I want to challenge each of you here today to remember to drink plenty of fluids at all times, but particularly when working outdoors and doing other strenuous physical activities. Make it a habit to become aware of your daily fluid intake. And lastly, to be especially mindful of your fluid intake during illnesses and while taking your medication. Thank you.
Excellent.